Hi, this video is focused on how to calculate a custom TPN for a central line. This video is just for educational purposes to help you pass your undergrad tests, so keep in mind this is for a central line, not a peripheral line. A custom TPN is a TPN mixture that's not pre-made. They're more expensive and some facilities won't even make them, so they're only used when absolutely necessary. Most of the time they're used with patients whose nutrient needs can't be met with a premix bag, like a burn patient who may need high levels of protein. When ordering a TPN, first you'll calculate your patient's nutrient needs using whatever formula you think is best for their condition. For this patient, I'm going to say they need 1,500 calories, 95 grams of protein, and 1,800 milliliters of fluid. So they have high protein needs, but lower fluid and calorie needs. Then evaluate whether your patient should have lipids. Lipids can be inflammatory, so you may not want to give them every day in a patient with high levels of inflammation. You'll also want to avoid giving them to patients with triglycerides over 400 or patients on propofol, since it is a lipid-based medication. If you do decide to give lipids, know that a 10% lipid solution will give 1.1 kcal per milliliter, and a 20% lipid solution gives 2 kcal per milliliter. Most dietitians, if they are giving their TPN patients lipids, will give 250 milliliters of 20% lipids per day, which will give the patient 500 calories because 250 times 2 equals 500. Then start with protein. If your patient has a recommended protein range, use the highest amount of grams to calculate your TPN. 1 gram of protein is equal to 4 kcals. So if your patient needs 95 grams of protein, multiply that by 4 and you'll see that 95 grams of protein will give our patient 380 kcals. Since our patient needed 1,500 calories, we'll need to give that patient 1,120 calories from carbohydrates and lipids, because 1,500 minus 300 equals 1,120. This slide goes over the lipids again. We'll say we are giving the patient 250 milliliters of 20% lipid solution, which provides 500 calories. We then have 500 calories from fat, 380 calories from lipids, which means we need to give the patient 620 calories from carbohydrates to meet our calorie goal of 1,500 calories. Dextrose is a carbohydrate source used in TPN. 1 gram of dextrose gives us 3.4 calories. So if we need 620 calories from dextrose, we divide it by 3.4 calories per gram, which gives us 182 grams of dextrose. Aim for the glucose infusion rate to be less than 4 to prevent complications. In the healthcare setting, you would talk to the pharmacist and physician about starting TPN. Each facility will have a different protocol, and each professor will have a different way they want you to write your TPN order for their test. I'm only going to give you the macronutrient calculations because determining the amount of electrolytes to give patients is for advanced dietitians. Most dietitians will only tell the pharmacist if they think the patient should be given electrolytes or not. This can be determined by the patient's labs. For example, if they have kidney disease and their electrolyte labs are elevated, you may not want to give them a standard electrolyte mix. You can usually start the protein in a custom TPN at goal. So we would give our patient 95 grams of protein on the first day of TPN. Dextrose should be started at or below 200 grams per day and advanced by 75 to 100 grams per day if there's no signs of refeeding syndrome. Refeeding syndrome is where the electrolytes are below normal levels while glucose is elevated.